So let us start with Nash Therapeutic study streak for today, which is 21 of June. And we'll discuss two remedies today, which are very small but worthy of mention because the important features that Dr. Nash has mentioned are very valuable to guide us in the prescription of these remedies in routine practice and not just once in a while. Petroleum and Hydrastis. One of the best antisoric remedies, petroleum, is what he mentions in the beginning when he starts petroleum. It causes and cures eruptions similar in action to graphitis. So you get an idea of how Dr. Nash wants us to see petroleum. So we have few viewers on YouTube and a few on Instagram, and Dr. Garima is back today. I hope you are inspired and you are reading Dr. Nash Therapeutics. If not, go again through this book again so that it gives you the inspiration that it's needed for every yearly boost of confidence. So, for petroleum, Dr. Nash writes it causes and cures eruptions similar in action like graphitis. Now, whenever you are giving graphitis or giving a thought to graphitis, the second best remedy that should come in your mind is petroleum. How many homeopaths write the differential remedies in their prescription to think of as a standby or a backup if the first remedy fails? We think of differential diagnosis when patients approach to us with different clinical symptoms and conditions. We should also keep in mind differential remedies. And once you do that, this is because the time when you see the patient in a certain perspective of your mindset, your case taking, and the same patient you will see after 15 days, 1 month, 2 months, 3 months down the line, your perspective may change, your idea about that patient may change, your way of looking at the same patient will change. So if you record the differential remedies right in the beginning or in each follow up, what you think of if this fails, it gives you an opportunity to hold on to that thought which you had for that remedy for the patient at that moment when you saw him first. This eases out a lot of, what do you say, problems in prescription for a homeopath, because if you don't note those remedies at the time of your first prescription or subsequent follow-ups, then your perspective will change every time the new follow-up comes, and when you go back and see the new case afresh, you will wonder why do you give so and so remedy in the first place when it was not indicated at all. This happens many times, even the experienced physicians will tell you this. So I urge you all to make a note of the important remedies which you think of at the time of first prescription. Make a note of those remedies in a corner of the case paper or digital record wherever you maintain. And whenever you see the patient subsequently, just review and see whether the remedy which is given by you is working, and if not, maybe after a certain time, 21 days, 1 month, 2 months, 3 months, whatever be your period of stagnancy that you see, do you need to change the prescription or give a new remedy or the same remedy in a higher potency? So for petroleum, Dr. Nash writes, causes and cures eruption similar in action like graphitis. There are eruptions on the skull, behind the ears, scrotum, female genitalia, hands, feet, legs, etc. Eruptions are worse during winter season. Aloes, alumina, sorinum are the other remedies mentioned by him. Hands, they chap and they bleed. All they are worse in winter and they get well in summer. Now, many patients will come and tell you this is a very common modality in most of the skin complaints, but you need to see if it is occurring every year as a repeated pattern and not just one incident as such. One case by Dr. Nash, which he gives in his book Leaders in Homeopathic Therapeutics, 20 years of eczema on the lower limbs, aggravated in winter, 200 potency, one dose, cured the patient in few months. How well we can wait on a remedy with a certain potency, and there is nothing else in the case, no other remedy indicated, no other diagnosis, no other way of case taking approach he had, just sticking on to the group of remedies that he had, 200, 250 remedies, not more than that, and he gave remarkable cures. Today we have so many methods, so many approaches, yet we are confused. This is the problem with the lot of information available. So I urge you all to go back to source books, read the cases again and again, cures, clinical cases, and you will get a beacon to go ahead in your homeopathic practice. Another case by Dr. Nash, just after the first case which he mentions in Petroleum, he tells us about chronic diarrhea with eczema of the hands in the winter, Petroleum 200 cured. So this is the combination we should look for. And in Allen's keynotes streak that we studied, soon the recordings which are there on the Instagram will be going away. Everything you will find on YouTube only. If you wish to go through all the Allen's keynote study streaks, go to YouTube and you will find Homeo Setu. All the recordings for Allen's keynote study streaks are uploaded there. For petroleum, Dr. Nash mentions chronic diarrhea with eczema of the hands. This is the component which we should act on and think and note it. These homeopaths were not just working on single symptom, but they were working on component prescriptions also. And a very nice line of thought I developed when I was also taking Allen's keynote study streak, and some new initiative is coming for all homeopaths to help you prescribe easier with using these components: diarrhea and eczema, gastric complaints and kidney complaints, Calibicromicum, diarrhea and eczema, petroleum. So this is going to be very easier for you if you stay tuned to Homeosetu on all the channels. You'll get some information how you can access what is coming up next. But for petroleum 200 potency, chronic diarrhea with eczema of the hands, petroleum cured for Dr. Nash. Symptoms are similar to Heparsulf, slight scratch suppurates. Petroleum also has headache in the occiput, heavy as lead. Seasickness, good remedy like cocculus. Many times we give cocculus for all the motion sickness. We should also give a thought to petroleum. I have seen petroleum acting more well than cocculus. It can be like 60% for petroleum and 40% for cocculus. And another thing which is important on the locomotor system, petroleum works well like causticum, cracking of the joints in chronic rheumatism. And you can think of petroleum with the antisoric remedies, sulfur, graphitis, causticum, and lycor. So give a thought to this remedy when you think of all the four remedies. There are many times we can't get these smaller remedies like petroleum in our minds because we focus more on the polycrest. But petroleum is nonetheless a good polycrest you can think of. Working with the components will make your prescriptions easier, and stay tuned to Homeosetu. It's going to be an eye opener for all the homeopaths. Next remedy we'll discuss is Hydrastis in relation to petroleum somewhat, and it is mostly used as a tonic by the old school back in that time. Nowadays it must be much lesser since there are a lot of chemicals available. But there is one peculiar symptom which is there, whether in old school, whether in homeopathic practice: dull aching pain in the stomach, which causes a very weak, faint, gone feeling in the epigastrium. Objective symptom which Dr. Nash tells us to see with our eyes open and also the mind open: stomach is sunken. There are other two remedies which he mentions along with Hydrastis. For sunken stomach, you will see the patient having a stomach which is sunken, which is like a shallow, it's not, it's emaciated, it's not flattened or not bloated. That is where hydrostasis can be thought. Sepia can be thought with uterine affections if it is there in emaciated females, and ignatia in sunken stomachs with hysterical and nervous affections. Hydrastis is good for chronic constipation. We all know about it, but Dr. Hale recommends it in tincture or low potencies. And there is a case by Dr. Nash given in Hydrastis. Long-standing cathartic the patient was using with consumption of flax seeds after every meal. Hydrastis helped this patient. So similarly, we have so many other patients where we are giving Nux Omega left, right, and center. We are giving, we are telling them to take Ayurvedic medicines, but there is Hydrastis which can be given in low potency. You can give it for 15 days, 1 month, 2 months, mother tincture, something like that. You will have to experiment. The more you experiment, the more you will get to open your avenues for newer approaches. For infantile constipation, Hydrastis is another good remedy mentioned by Dr. Nash. All those children who are getting trained for passing stools in their lower ages, or in the higher ages where they eat a lot of rubbish but are not able to clear stools, Hydrastis can be given a thought provided no other symptoms are existing. And if the other symptoms do exist and you wish to give constitutional, give a constitutional dose once in 15 days, once in a month, or once in 2 months, but Hydrastis in a low potency for every day, maybe alternate day or 3 days a week. This is going to settle also the local affection, which is what Burnett all used to do in many of his cases. Hydrostis, like Calibicromicum, has viscid stringy discharges, whether it is the nasal or whether it is the female leukorrhea or any other discharges. Everything will be viscid and stringy in nature. So I hope today's session has given you some inspiration to go back to our source book and read Dr. Nash's Leaders in Homeopathic Therapeutics, and for some interesting more such study and something more. Stay tuned to Homeosetu on WhatsApp channel, Instagram, Facebook, YouTube, and soon we'll be out with very useful information for all homeopaths. Thank you for joining.